Welcome everyone to our panel on climate, health, and migration. My name is Eric Redding. I'm the Division Vice President for International Development of Apt Associates. We're a consultancy that's working around the world on issues in health, climate, and other areas. I'm joined today by a really terrific panel that's been focused in on the issue of health, migration, and climate, and they'll be joining us online. But as I think all of you know, climate-related events are really driving vulnerability around the world. And in particular, in the area that we're going to focus in on of Latin America and the Caribbean, there have been a large number of climate-related events, whether those are storms or droughts, that are driving very significant amounts of migration in the region. For example, the hurricanes Eta and Iota last year displaced more than 1.7 million people in the Caribbean from their homes. That was quite a significant event that drove people to migrate. There have also been droughts in Venezuela and Central America recently that have fueled the driving of migration. And a robust humanitarian response has occurred to many of these events that has helped to mitigate it. But that humanitarian response can only go so far in an emergency situation. And as these migrations are getting larger and longer, it becomes very important to think about the long term and think about how migrants are being integrated into health systems that are already stressed and strained from operational and technical difficulties. So what we'll look at today is approaches that have been taken to this issue of migration and how that can be integrated into health systems. As I said, we have a terrific panel, and let me introduce them first, and then I will hand off to them to each introduce themselves and say a few words. Dr. Joy St. John is the Executive Director of the Caribbean Public Health Agency, or CARPHA. CARPHA is based in Trinidad and Tobago and serving 26 member states, mostly the small island nations of the Caribbean. The agency is the Caribbean's collective response to strengthening people-centered and evidence-based health systems and approaches, and addresses the nature of the changing public health challenges. Dr. Aleksandar, and you won't be able to see the faces of the people until they begin speaking. Dr. Aleksandar Arnikov is the International Organization for Migration's Regional Migration Health Specialist for the Americas. He's based in San Jose, Costa Rica. IOM provides effective, coordinated operational responses and policy advice to complex and shifting dynamics of migration in Central America, North America, Caribbean through three lenses: resilience, mobility, and governance. And then two of my colleagues from Apt Associates, Dr. Miguel Pulido, is the head of our program in Colombia for the Local Health System Strengthening Program. This project is supporting the strengthening of Colombian health system to absorb Venezuelan migrants and Colombian returnees, and to increase the resiliency and respond to the current and future shocks, including the COVID-19 pandemic. And Dr. Paulina Maria Giusti is the head of the LHHS program in Peru. This program is helping the government to address the additional HIV-related health system demands from the influx of Venezuelan migrants and to strengthen the government of Peru's COVID-19 response. So each of the panelists will present for a few minutes, and then after that we will take some questions from the audience, and I'll have some questions of the panel to discuss with one another. So I turn it over first to Dr. Joy St. John.
Thank you very much, and it's a pleasure to be here. Just a quick word about CARPHA. It's an amalgamation of 5 regional health institutions, and it's all things public health. And as we have an intergovernmental agreement with a specific mandate for serving the CARICOM countries, and our member states are actually wider than CARICOM, we have been very proactive about a lot of the things that you're discussing today. Next slide, please. And this gives you a little snapshot into the public health imperative. We are about assisting CARPHA member states in developing migrant health policy, in the delivery of universal health care. And initially the focus was on Venezuela, but we've discovered, and especially through COVID, that many other countries, and not all related to the region of the Americas, have been coming into the CARICOM space, and also to implement epidemiological profiling so that there can be good planning. So we have had a systems approach, because if you are serving 26 member states, you have to do it in a systemic manner. And we're also a region which is heavily burdened by NCDs. And a lot of our migrants also have NCDs. So the issue of acute care, chronic care for communicable and non-communicable diseases is part of what we're trying to support member states in planning. Next slide, please. But we could not be doing this without the major donors for climate and health. And we've got the EU CARIFORUM project. We've also been collaborating very closely with PAHO on that, as well as the Caribbean Institute for Meteorology, Hydrology, the 5Cs, and University of the West Indies. So the CARICOM institutions and CARICOM cited institutions are working with international and being supported by EU also for a climate project specific to climate and not just climate and health, which is managed by the 5Cs. And we have support as well for IDB. And there is also a specific project on vector control, because climate change is not just about hurricanes and droughts. It's about effects on existing disease. And we've noticed that the life cycle of the mosquito has increased. Next slide, please. And one of the greatest collaborations, which is allowing systemic health sector strengthening, is the Health Climatic Bulletin. So what we do, we get together with the Caribbean Institute for Meteorology and Hydrology. They forecast the weather for a quarter, and then CARFA and PAHO supply what could be the effects of that climate and the variations in weather on disease. So we've been able to continue this even though we're in COVID. And it's a very critical tool for systemic work, and also an excellent example of multi-sectoral, multi-agency collaboration. Over.
Thank you very much, Dr. St. John. Next, we are going to hear from Dr. Aleksandar Arnikov from the International Organization of Migration.
Good morning from Costa Rica, and thank you for having me. It is an absolute pleasure to be part of this panel. Today, I am going to be speaking about the link between climate change and migration and health. And I'm also looking forward to our discussion on how we can move from a reactive to a health system strengthening response. Next, please. To begin, allow me to share a few important pieces of information about the scale of movements in the Americas. So a total of 55 million people in the Americas were on the move in 2020. And this number includes those migrating to the north, mainly to the United States, then those in the inter-regional migration flows, transit flows, and return migration flows. Also, irregular migration across the Americas, as shown in this example slide from South America, has significantly increased in the recent months. Again, mainly towards the United States and Mexico as a stop before the United States. As you can see, different nationality groups may use different routes, but they do have a few things in common. And one is that they all use the irregular border crossings that expose migrants to increased health vulnerabilities and extreme risks, including violence and gender-based violence, exploitation and abuse, extortion, and death. Next. While in transit, migrants, especially those in an irregular situation, but also families with children, women, girls, and boys, find themselves in situation of extreme vulnerability. So this is exacerbated by limited access to basic services such as healthcare services, shelter, food, water, hygiene products, psychosocial support. Language can be also a major barrier for some of the migrants to obtain information on migration regulations, aggravating the risk of exploitation and abuse, while also limiting communication with authorities. So the flow of migrants, large flow of migrants, have also stretched the capacity of many host and transit communities, some of which have become hotspots for rising incidents of xenophobia and violence between migrants and host community members and between migrants themselves. Therefore, IOM is mainly focusing its response with regards to migration and health to access to high quality health services for migrants, promote evidence-based migration health policies, and migrant-friendly and migrant-inclusive health systems, following the principles of the Global Compact of Migration, Agenda 2030, universal health coverage, and many, many other instruments that support safe, orderly, and regular migration. Next. The maps you see are very compelling and have a lot of details that I'm not going to discuss now, but they do show the key climatic risks and impacts, like increased or decreased precipitation. They show the main consequences, like reduced water availability and related social challenges like vulnerable indigenous populations or megacities. But they also identified climate change hotspots. That is the areas that experience a combination of several extreme climatic risks. So what is the link between these maps and the health of migrants? So climate change indeed affects human health, and there is no doubt in that, directly and indirectly. Directly, it increases morbidity and mortality, including heat-related and disaster-related injuries. And indirectly, it affects health through changes to social and ecological systems, food security, availability of fresh water, changing distribution of disease vectors, and different pathogens. As we diminish biodiversity by cutting down forests and building more infrastructure, the risk of diverse pandemics, such as COVID-19, is increased. We are witnessing the struggle of the health systems, even in the most developed countries in the world, to respond to the needs of the population to COVID-19. But even before the pandemic, migrants had a greater vulnerability to diseases due to often inadequate living and working conditions and limited access to health services. Evidence shows that the pandemic has exacerbated many of the existing health vulnerabilities faced by migrants. And it is often the poorest, those who find themselves in irregular situations, those who are displaced by natural disaster or conflict, or those who do not have equitable access to health, including immunization services. Next. So the COVID-19 pandemic has only emphasized the need for a coordinated response. And these 55 million people that I mentioned earlier were on the move alone or in large groups for multiple reasons, fleeing poverty, violence, discrimination, and increasingly leaving behind disasters caused by extreme weather events that have devastated their communities. For this reason, climate change and health nexus need to be urgently prioritized, as many migrants experience increased health vulnerability. In this context, IOM is intensifying its efforts to develop joint action across its climate migration and migrant health work streams, with the institutional strategy that you can see at the slide being only one example of a comprehensive and evidence-based approach to this great challenge. In summary, and I'm finishing now, we need to indeed roll up our sleeves and find solutions for people to move, people on the move, and people to stay with regards to climate change. Also, we, the public health and migration officials, must use the experience of COVID-19, Ebola, SARS, and MERS outbreaks. We learned that values such as equity, solidarity, and collaboration are central to resilience and essential to drive effective response. Therefore, we must build on this experience to restructure our health systems, set priorities, shuffle available funds, support the health workforce, restructure the disease surveillance system, communicate properly, this is very important, and above all, work together. Thank you.
Thank you very much, Alex. Next, I'd like to introduce my colleague from APT Associates, Dr. Miguel Pulido, who's speaking to us from Bogota.
Thank you, Eric. So glad to be part of this event. Colombia is a country well known for immigration of its people. Now, however, is being known more as a receptor country of migrants, mainly from Venezuela. Next, please. Colombia and Venezuela, countries that share a 2,219 kilometers of border. This situation is having serious effects on many social and economic aspects. One of these is the healthcare sector. Let me start with sharing some data with you. Approximately more than 1.8 million Venezuelan migrants living in Colombia right now, but almost 3 million Venezuelan migrants are expected to be residing in Colombia in the next few years. We have different types of migrants, status. This is important to say the status, not the people. We have regular status with a special resident permit. We have irregular undocumented migrants and pendular migrants, migrants that are going back and forth between this border. Something that is very important to say with you right now is that we, the government of Colombia, made an historic decision early this year to regularize Venezuelan migrants, called Temporary Status of Venezuelan Migrant Protection. Under this scheme, Venezuelan migrants can get access to education, health, official employment, and other benefits. Next, please. We, as a project, we are not a humanitarian project. Our program, our project is a technical assistance project here in Colombia. Something important, we start almost 14 months ago in the middle of the pandemic and also in a peak of the migrants in Colombia. All our actions have been taken into consideration the issue of long-term sustainability, because it's important to be reactive in some crises. However, it's better to strengthen systems. Creating and working is one of our philosophies here in our program. We are co-creating with other USAID projects and also with other international cooperation. We have 4 different aspects that we are working. Public policy tools. We are working in the roadmap for the inclusion in the general social security system here in Colombia. And also, we are working and helping the government in the 10-year public health plan that is going to be implemented between 2022 and 2031. We are working in the sustainability financing enrollment in general social security system. So far, we are helping more than 6,000 migrants, Venezuelan migrants, to be enrolled in the health system in Colombia. And also, we are developing packages for healthcare services. Next, please. We are helping more than 170 healthcare workers training in quality improvement. It's not only just to get access to the health sector, it's get access but receive quality in all the attentions. Working in the middle of the pandemic, we start to help the Ministry of Health and some secretaries of health in the strengthening the public health surveillance. More than 50,000 people between health professionals and community leaders were training in COVID-19 prevention. We create more than 30 rapid response teams that each team was confirmed by an epidemiologist, a doctor, a nurse, and nurse assistant to face and work in the middle of the pandemic. More than 40% the territorial entities have been supporting in the development of a span immunization program now that we are working in the vaccinations COVID-19. More than 3,005 health professionals training on the national vaccination COVID-19 plan guidance. Next, please. We have big challenges for the next year. We are working and supporting the government to reduce the financial barriers to care and the treatment. We are also helping the government to the implementation of the roadmap for the inclusion of Venezuelan migrants in the general social security system. We are helping the support and develop a strategy for digital transformation in the healthcare system. We are trying to improve the quality of the health system by increasing the number of healthcare workers training in quality improvement. We are strengthening the health sector in aspects now that we are facing the pandemic, but we are having new issues. Maybe we are not working in intensive care unit, but now we have to start to think about mental health response, and that's something that is important for our project. Next, please. Thank you so much.
Thank you very much, Miguel. Our next speaker is my colleague, Dr. Paulina Maria Giusti, who's speaking to us from Lima, Peru.
Thank you, Eric. Good afternoon to everybody there in Glasgow from here in Peru. Peru, as Colombia, used to be a country who produced migrants to other countries, and now we are receiving migrants in a bigger scale. Our project in Peru is focused on Venezuelan migrants living with HIV. Next, please. Peru has received in the last few years 1.2 million of migrants. After Colombia, we are the second country in Latin America receiving the most amount of migrants from Venezuela. When migrants arrive the country, they come with chronic and non-communicable diseases, mostly with asthma and hypertension. About 10% of migrants came with chronic diseases, but we went look for if they receive treatment for their chronic problems. We find that most of them don't receive treatment. You can see in the graph in the right that almost 80% of migrants who have chronic conditions that do not receive treatment for them, with the complications that could be that could generate. Please, the next, please. The project, as Eric said at the beginning, is helping and providing assistance to the government of Peru to address the additional HIV-related system demands due to the influx of Venezuelan migrants. In the graph in the left, you can see the increase of Venezuelan migrants receiving treatment for HIV in the country between 2018 and 2020. And they increased from 200 at the beginning of 2018 to 3,200 at the end of 2020. We have two main objectives in the project. The first one is to improve the availability of comprehensive and high-quality HIV services for Venezuelan migrants, and the other one is to support planning for cross-border continuity of care for migrants. We have just begun this year, we began in May, and we are working with the Ministry of Health to do a health system assessment that we have just finished. And we are going to share some of these results with you. Next, please. Here we can see the situation of Venezuelan migrants that start treatment with antiretrovirals in Peru. More than half of Venezuelan migrants already have been diagnosed in Venezuela, and a big percentage of them have interrupted their treatment for more than 6 months when they arrive to the country. So probably a result of this abandon is that 1 out of 4 migrants living with HIV are already in AIDS stage when they reach the health service in Peru. Now, in the right graph, we can see the percentage of co-infection and abandon of treatment in persons living with HIV that are in treatment in Peru. In the blue color, you can see the percentage for all the people who are in treatment in Peru. And in red, you can see the percentage of Venezuelan migrants that are in treatment. We can see that the abandonment of treatment is lower in Venezuelan migrants, but the co-infection with TB that we are finding is 37 times higher in Venezuelan migrants than in people living with HIV in the same territory. And that is something that is shocking and what we have to face with. Next, please. Here are some, the few barriers to access treatment identified by the health personnel who works in HIV services. I have to say that in Peru, treatment for HIV is free for everyone, no matter your migration condition or status, as Miguel said. And government pays for treatment and pays for diagnosis tests. However, there are some costs that the people have to afford if they don't have a health insurance. Costs like lab tests previous to begin treatment. And that is a big barrier for Venezuelan migrants who many times that don't have the money and they have to wait to obtain the money. Sometimes they are helped by international organizations or NGOs that work with them, but sometimes they don't have access to that aid and they have to work many days or delay the beginning of treatment. The other barrier, main barrier observed is the access to health insurance. In Peru, the public health insurance is free for nationals and residents. But if you are a foreigner, you are a resident if you have a resident card. But many of Venezuelans does not access yet to that. And then we can find some other aspects linked more to the health services, like inconvenient hours or waiting times and others like that. When we ask people, Venezuelan migrants that are already receiving treatment, besides the economic problem, they talk us about discrimination. They feel that they are discriminated mainly because they are HIV patients, and very less is the claim that they are foreigners and they are discriminating because of that. With these results, we are working with the Ministry of Health, developing a strategy to capacity building and developing strategies to overcome these barriers. And there we are in this. I think that migrants share problems with all migrants in all regions. And we are working with the ministry to deal with these things. Thank you very much. Go to you, over to you, Eric.
Thank you very much, Paulina. Thank you, Paulina. So now we have time to take questions from the audience for any of our panelists. If you're interested in asking a question, just put your hand up and my colleague can bring the microphone to you.
Okay.
Here.
Hi, my name is Megan Kircher. I'm with the Yale Center for Environmental Law and Policy, and I focused on climate migration from a refugee and asylum perspective. So I was wondering what you think, any panelists, what you think the role is of regional immigration agreements in, lessening the burden on any individual country's health and infrastructure.
Great. Joy, would you be interested in taking that question first and maybe Alex after that? Did you guys hear the question?
That's a great question. Did you want to see it again?
Sure, I can paraphrase it. What are your thoughts on regional agreements and kind of regional integration around health services in a way that would benefit migration? Is that the gist of it?
Right.
Well, regional agreements and regional integration is the reason why I have a job. And it has worked for the CARICOM region in COVID-19 because there was the secretariat infrastructure that also allowed for convening groups and coming to agreements on combined action, changes in policy, changes in legislation. So what is required as we have listened to such interesting presentations is a type of coalescing of agreements of many sectors to really get this to work. So yes, in a nutshell, you're correct. This is what is required. Do we have the appetite for it? Then someone else can answer that.
Thanks, Joy. Alex, did you have anything to add to that?
Yeah, actually, I would say that maybe the free movement agreements are crucial to enable persons displaced by disasters to seek. So this was the case with in the 2017 hurricane season in the Caribbean, when we had this more than 10 or I don't know how many hurricanes, cyclones in the Caribbean. But it's also important that free movement is complemented by contingent rights, enabling migrants to access health services abroad as well. Also, I think that we had this very similar intervention in Costa Rica after the Hurricane Mitch, I think, when they granted visas for people. So, I mean, these regional approaches are exceptionally important, not only for emergency relief, but also for sharing the experiences, sharing the knowledge. And, you know, I mean, especially for the Caribbean, for example, because in at certain point of time, either the whole region or at least one or few islands will be affected. So not only for the coordination purposes, but also to for better distribution of funds available, human resources, financial resources. This is exceptionally important, especially when the time is key to response. So yeah, regional coordination is absolutely important for provision of timely and well-organized response.
Thank you very much. Paulina, Miguel, did you have anything to add, or should we move on to another question?
I think we should move.
Okay, great. We have a question here in the audience.
Hello there. Thank you very much. I'm from the Royal College of Psychiatrists. So my question is to those of you organizing healthcare provision, how are you able to either assess or meet the needs, the mental health needs of migrants? And I'm particularly interested in children and young people, whether that's looked at or whether you have any capacity to provide for this area.
Great. I think Miguel might be in a good position to answer that one from the Colombia example.
Thank you, Eric, and excellent question. Yes, it's not only start to work with the problems from the migrants. Here we are working also in mental health of the healthcare workers. If they are in a good shape, if they are healthy, if they have the capacity and the ability to support these people, we can integrate all the action. Of course, it's important, you know, the things, the mental health with children, women, all the migrant population. And we are starting now in this year, working with healthcare workers, and also, you know, in parallel, some actions to provide healthcare services to the migrant population. Not only vaccines, not only, you know, the emergency attention. We are strengthening the local providers in mental health.
And Miguel, if I'm correct, the migrants are receiving the same care in all areas that Colombian citizens are provided, correct? So any mental health care that's provided to Colombians would be included for migrants as well?
That's exactly the situation here in Colombia. Yes, Eric.
And anything else to add on the mental health question?
If you don't mind, I am of the view that we have to use the COVID-19 pandemic as an opportunity to reset how we look at migrants, as not as them and us. So I was really impressed that access is at the same level and rate for nationals as for migrants. And I think this is part of the reason that we in CARFA have worked with first our own staff. We do constant mental health checks on groups and also the staff as a collective. And we have also been trying to work with the ministries of health to encourage them to do this. I think we need to get away from the stigma of mental health. And if the provision of services to migrants can help in that elimination of the stigma, it's going to help these societies as well. The mental health effects on children are documented. We have instances of children during the Dominica event when there was rain after that severe flooding event in 2014-15. There were children who would start screaming when it rained. There were children who asked, why is God doing this to us? So more focus on the children and more recognition that migrants are people too, and they need to have access.
Thank you, Joy.
Mental
Paulina?
health is a big issue in our countries, not only for migrants, but for the nationals in each country. In Peru, the government is expanding community mental health services, but it is also extended for migrants, but migrants face this, in access to these services, face the same difficulties as nationals, and that has to be keep in mind, because when we talk services for migrants and you have a country that has problems to give services to their own people, you can't divide. This is for migrants and this is for nationals. This is for all the people who is in the territory. So you have to keep this in mind. When we talk about migrants in our country, we are talking about the same problems that the nationals face. And we are talking about strengthening services for all of them.
I just want to add one point, Maria Paulina. Yeah, if we are doing that, we also are working to prevent xenophobia, because we cannot have different plans and different things, because you are migrants, or you are a local. No, when we are talking about system, we all are part of the system. That's a good point, and thank you for
I would just add, I cannot agree more with my colleagues, and I would just add that mental health is always part of the response of IOM as overall health response, and we have many different programs that are addressing these issues among migrant population, also women and children. But what I want to say is that sometimes mental health is seen as a separate aspect, separate area of overall health response, which might be good, but also might be contributing towards xenophobia and stigma, because it's in some areas migrant health is perceived as a very peculiar problem for migrants, and in many cases this can be assigned only as a migrant health issue. So maybe if we approach to this as an overall health problem and improve the access to health services, not emphasizing only that this is a mental health support, maybe we can be having better achievement in this area.
Thanks to all of you. We have another question over here on the side. It's on as soon as you begin speaking.
Sven Harten from Germany's Development Corporation. I have two questions. So the first one is, sorry. That's better. So the first one is, in your experience, and thank you for those excellent presentations, is there anything particular about climate migrants? Because like the example, for instance, from Venezuela, I guess part of the reasons are also political, economical. So what are you seeing in terms of climate migrants? What is special about that that problematic? And then the second one being from the bilateral cooperation. In your view, what can international donors do to better respond to climate-induced migration? Thank you.
Yeah, I think with the Caribbean being particularly vulnerable to climate migration, and obviously Venezuela has a lot of roots in drought, maybe we'll start with you, Alex. You want to speak to that question on specific climate migration and what it's meant in the region?
Yes, specific climate migration. Yeah, first of all we need to realize that basically there is still not much evidence, and research is very exceptionally important here in this area. So therefore we need to. Sorry, there is some echo. I don't know if you can hear me well. So yeah, as I was saying, research is exceptionally important in this area. So therefore, I believe that providing more information and evidence-based information to inform the decision making is maybe the key to the solution. So basically, what we do specifically is we for example, in Peru, we conducted a very detailed literature review on the patterns of migration closely related to migration, to climate, sorry. And also the same case in Caribbean, specifically with gender and environmental movement. So, you know, I believe that maybe the key to this response would be the key to this response would be the research as well. And in terms of the donors, I would say that not all the donors are very interested in. I mean, sometimes it's really challenging to find appropriate financial support to provide the programs to support the stay or help to move. You know that we should also focus on the how do you say this, the people on the move, people to move, and people to stay, you know. So this kind of programs needs to be also supported. But again, it's quite a challenging issue because of the lack of maybe evidence-based information that can support the decision making. So maybe we can start from there.
Joy, in the Caribbean island nations, you've seen increasingly frequent and devastating hurricanes, and that's really caused an enormous amount of displacement. I was in the Caribbean after one of the recent major storms, and maybe you could speak to that sudden displacement that happens in the case of hurricanes and major storms in the Caribbean.
Okay, so the Caribbean has always been an area of internal migration, and there were two instances that I would like to speak to. One is post-hurricane, and then one is post-volcano, because don't forget, we had a volcanic eruption as well to deal with. What happened post-hurricane for Antigua and Barbuda is that the whole country of Barbuda, although it's subsumed as part of Antigua and Barbuda, it's a separate geographical island. That whole country migrated to Antigua. And it meant, therefore, the need for an expansion of normal services like water and so on, electricity and so on, as well as the public health issues that could have arisen because of sheltering and the like. It demanded also that there should be regional solidarity because Antigua needed support. Then when we had the whole issue of the volcano. We had a whole section of an island that it was thought would need to evacuate. CARFA moved in quickly at the request of the Organization of Eastern Caribbean States to develop protocols which would have minimized COVID spread during the evacuation process and the shelter process. In the end, very few people, I don't even know if 100 actually evacuated from St. Vincent, but they evacuated from a part of St. Vincent to another part. And so we had this whole issue of trying to deal with shelter situations and to minimize COVID spread in those situations as well. And also because a hurricane is not a volcanic eruption is not a finite event like a hurricane. We also had to deal with a slow burn, not a sharp and sharps happening and stop, but a slow burn, and what that meant to the retooling and re-equipping of the health services and also the surveillance of disease. So we have had to think on our feet in the Caribbean and get things done. Yes, we have a lot of support, but the support is sometimes not experienced with the kinds of permutations and combinations that small, under-resourced health systems have had to deal with. And so a lot of the help has to be brought up by Caribbean brains who have had to deal with that kind of lack of resource. It's been quite a rough ride.
And I know that all emergencies are complex emergencies, but it was an interesting facet to me that while a lot of the dynamics are political and economic in Venezuela, the drought has been a really significant part of what has driven migrants away. I wonder if there's any particular dynamics that Miguel, you or Paulina have faced because of the drought situation and seeing particularly rural migrants coming to Colombia and Peru. Anything to add there in that area? We can take another question from the audience then.
Want to start, Paulina? You want to say something?
Be my guest, Miguel.
Yeah, just here in Colombia, and actually our program, LHSS Colombia, is helping the government to think, not only to respond to the event, is how prepare for future events. It's not only, we are not working only in COVID, we have also internal migrants, because we have climate different effects. We have two oceans, we have volcanoes, we have different things. But the most important thing that the program is conducting right now is working together the central government and the regional government, because this country is a very multicultural and different. It's like having 32 different countries in one. And we are preparing for future emergencies, for future possible events, not only just to add and react. It's more thinking in the long term. This is something like I just want to add about that program here in Colombia.
Yes, in Peru, we also have internal migrants due to climate changes. We have a major earthquake about 10 years ago, or something more, and we have floodings in the north of Peru that make us to deal with emergency, and that is a big deal, a big thing to deal with. As Miguel said, we are preparing. We are always preparing to improve our strategies to deal with these major natural disasters. And as a project, we are also working to improve the preparation of the country, because we are working also with COVID just now to deal with future emergencies. And that is always a long process to deal with after a disaster. And about migrants, I wanted to say that migration, as we are receiving in Colombia, in Peru, not for natural disasters, but the problems in Venezuela in this case, has to move from humanitarian assistance to integration to people in the country. No, but at the end of the day, migrants most of them will remain in the country and will be part of the country or will contribute will be an asset to the country if we can see them in that way. No? And our policies should be directed to understand and implement that.
Great. Thanks, Paulina. I think we have time for one last question from the audience. Up here.
Thank you. Paul Faith, APP's Technical Director for Climate and Energy. I'm wondering, there's a lot of climate modeling, and that analysis has been downscaled to show for different, particular places how the climate might change in the future. And I'm wondering if any of that analysis is used in this sort of regional or country planning. I'm just wondering, as the comment was made about, doing planning for future events, but there's also the magnitude of those future events could be considerably larger than the magnitude of current events.
I wonder, Joy or Alex, that might be in your court.
Joy?
Okay, let me start the tennis game. So, yes, the part of the presentation where I spoke about the Health Climatic Bulletin is that kind of modeling. And apart from what we do in collaboration with the Caribbean Institute for Meteorology and Hydrology for weather and its effects on climate, that is short term, but we've also been forecasting on the longer term and also recommending and training health care workers and leaders on how they can adjust the health sector to project for what will be needed. That kind of forecasting is also being used for urban and rural, but more so urban planning. And urban planning with a lens to the health status of the citizens. So urban planning that tries to prevent or deal with NCDs. So yes, the kind of forecasting that I mentioned with the Climate and Health Bulletin is being done in other sectors, which makes sense. Climate is going to be affecting all sectors, if we like it or not. We haven't yet got to the kind of forecasting that is done in the Pacific Islands, where they've actually bought land for countries to move to because of the issues of sea level rise and so on. But we may need to think about that because we've started to see saltwater intrusion into our aquifers. And this will require some quick work on the behalf of the water authorities and also the health services, because more salt means more hypertension.
Thanks, Joy. We're running a little short on time here, but Alex, anything to add in about 60 seconds?
Yeah, 60 seconds, yeah. I would say that, yes, we are relying on technology, and absolutely we are open for any suggestions for any kind of modern and innovative approach that can help us better planning and better distributing the resources available for any kind of support that IOM as an organization and with our partners we can provide. Therefore, yes, modeling is absolutely important, and I would say that any kind of collaboration in this area would be exceptionally beneficial. And again, we are very open for this. And yes, we are using, and we will be probably not probably, we will be using it in the future. So this is my 60 seconds. Thank you.
Great, thank you, Alex. Let me
I made it. No,
lose my earphones here. Well, thank you all for joining today. Just a few key points to think about as we close here around climate migration and health. First, I think it's important that all of us keep in mind the OECD principles for migration and health from 2018, which is to streamline and integrate migrants into care, and in the short term, providing migrants with some sort of medical screening and clear links to the coordination and different kinds of health systems and stakeholders. In the medium term, removing barriers to access to care. Then in the long term, as we had the comment here, anticipating those future influxes and other long-term needs that will happen with migration as patterns of climate change, as conflicts cause migration. It's important to support health system resilience in a way that balances that response to immediate emergency needs, as well as those long-term solutions, which can be achieved by integrating migrants into the regular health system rather than creating new programs. And in that long run, a system strengthening approach is likely to prove more cost-effective to governments than providing those emergency services, which are very costly to stand up and exclude migrants from the regular healthcare systems. And finally, that system strengthening approach includes both migrants and host communities in decisions and processes, and it can also be helpful to diffuse the political and social tensions that begin to emerge in host countries and improve outcomes for tailored sustainable responses. So in the long term, that systems approach can really help eliminate the inefficiencies and build the required strategic redundancies, surge planning and other things that allow influxes of migrants to be absorbed as we see these occur more and more around the world. So we thank all of you for joining today, and we thank our panelists who are incredibly informative, and we look forward to seeing you all again.
thank you.
Thank you. Bye.
Bye-bye.
Bye, ciao again.